Good afternoon. Welcome to the Empowering Family Caregivers Show, brought to you by eCareDiary.com. I'm John Mills. I'm substituting for your usual host, Susan Bida, and I am a co-founder of eCareDiary. Today is July 15th, and we're going to talk about hospitalization risks for senior citizens. And we're very excited to have with us Dr. Eric Rackow. Dr. Rackow is the president and CEO of Senior Bridge, a national health company that provides integrated care management and direct care by licensed nurses and social work care managers and caregivers in the homes of seniors. And I do want to say that I've used Senior Bridge for my father, who suffered from Parkinson's disease for a decade, and I had a wonderful experience with them. Dr. Rackow has more than 35 years of experience in healthcare and is a professor of medicine at NYU School of Medicine. He is currently chairman of the Board of Trustees of the Weil Institute of Critical Care Medicine, dedicated to education and research in caring for patients with severe illnesses or injuries. You can find more about Dr. Rackow and his organization at www.seniorbridge.com. So welcome.
Thank you, John. Pleasure to be here, and I'm glad we could be of help in taking care of your father.
Yeah, as we discussed, we went through a couple of other agencies, and we just found Senior Bridge to be terrific. And as I think as we were just talking before the show, one of the things you specialize in is more of the long-term care continuum, which is really what my father needed.
Right, and so that's a very big issue in health care today and in elder care today, because as people get older and as the population ages, they develop chronic diseases, they develop functional limitations in being able to take care of themselves, like a person with Parkinson, and that's a specialized area where you have to understand how to take care of people over a long period of time, rather than just for acute episodes, intermittent episodes. So that's a real specialized area that Senior Bridge is particularly good in.
Well, I wish I'd known that at the beginning of his need for care, but I'm very glad we found you guys as we were caring for him. So we want to talk about some of the big challenges that senior citizens face, or family members face today in caring for their elderly loved ones. So what do you see as the biggest challenge that they face navigating the world of senior care?
So just like your family, one of the very big problems is that navigating elder care, whether it's for health care or for other issues that are important, is complicated. Our modern society is very complicated. There are lots of options, and when the family tries to do that, they get overwhelmed often with all the information and all the needs that they have to take care of. And family caregiver stress is a very big issue in terms of taking care of older people, taking care of your parents. Usually it's the adult children that take care of their parents. Many live distant from where their parent is, so one of the very big challenges is to create an environment and create an opportunity for the family to care for their loved one and use a professional to help solve those problems, care coordinate, organize the care, and that's what Senior Bridge does. As you know, we use care managers who are licensed nurses and or social workers, and they coordinate the care of the person, not just their medical care, but their taking of medications, advising about nutrition, making sure the house is organized correctly, making sure the house is a safe place to live. Something as simple as making sure there's not a throw rug in the hallway from the bedroom to the bathroom that an older person might trip on. So a family often gets really overwhelmed by doing all those things, and that's when they need a professional care manager to help organize in a holistic way how we can take care of a senior citizen that needs that help.
Yeah, I thought it was really interesting you mentioned home safety, because one of the things I didn't realize, but it makes a lot of sense, is the fact that the home is actually one of the most dangerous places for a senior citizen. And people, worry about being outside and things like that, but actually there are more accidents in the home than anywhere else.
Absolutely right. And so as a person gets older, not only do they develop illnesses, but they develop functional limitations where they can't quite manage as well as they used to in terms of taking care of their home or themselves. So for example, they don't shop so well, or they don't prepare meals so well, or they can't manage transportation, or they can't manage their medications. And as that occurs, as they develop functional limitations to what we call self-direct or manage their environment, the home becomes more unsafe. And so it's important that the home be organized. And often it's little things like, is there a handrail in the shower or the bathroom? Is the toilet seat elevated so that people can get up and down? I always tell the story about my mother. Someday my mother is going to see one of these and she's going to catch up with me. But my mom lives in Florida, and she has in the front hallway, when she first walks in of her apartment, a throw rug. And so I go visit and I say, Mom, we got to take the throw rug away, and I do. And I go visit again, it's back where it was. And so this has been a battle now for about a decade. But it's important that we can make sure that the house is well organized so that people are safe at home.
No, it's very important. That's a funny story, but I think everyone has some story
Similar
about
story.
similar story. One of the things I also want to talk about is, why are senior citizens more at risk for hospitalization than the rest of us?
So that relates back to the fact that as you get older, it's hard to self-manage and take care of the things you have to do to make sure you stay healthy. So as you get older, you develop more chronic illnesses. And what we know is that 3/4, it's actually quite remarkable, 3/4 of people over age 65 have at least 2 chronic conditions. And as you develop chronic conditions, you also develop these functional limitations, so you don't remember so well. You start to lose memory, and usually as an older person starts to lose memory, the first thing that happens is they lose what's called short-term or recent memory. So, your parent or your grandparent can remember all the kids' names and the grandchildren's names. They can remember every birthday. They can remember everything they gave on that birthday, but they can't remember if they took their medicines this morning or what they took. They develop other limitations, as I said, in terms of taking medications and getting mixed up. We were talking before about the fact that there are so many different medications. They're all different colors. There are generic medications. Often the pharmacies switch which generic drug they use. It's a different color. Often you have a brand medication and a generic medication, and it's confusing. Are they the same or different? So managing medications is a very big issue. So when you put all that together, an older person, a number of illnesses, a number of medications, a bit of limitation in memory, and perhaps managing money and medications, and then the patient goes to the hospital because they're at high risk, because care is not organized, their medication management not organized, and they end up in the hospital because they're undertreated. And so organizing how the person can function with a professional care manager, which is what Senior Bridge does, allows that person to stay healthy and more functional at home and stay out of the hospital. Actually, I would tell you a little statistics from our experience. We reduce hospitalization rate, emergency visit rate, rehospitalization rate by more than 2/3 in the patients we take care of by care managing them at home.
That's great. And my father didn't get readmitted back into the hospital after Senior Bridge. He was in Senior Bridge until the very end when he had a stroke.
Right.
So and he had been in and out of the hospital in emergency rooms for the better part of 18 months before that.
And that's the common story. And a lot of it is blocking and tackling at home. You have to have a professional who knows what to do, but making sure the basic things are taken care of.
Speaking of readmissions, and that's a big issue because Medicare is changing the rules around readmission for same procedures. How do you know if someone's at risk for readmission? Are there certain signs you should be looking for when they get out of the hospital that maybe they're at risk for going back into the hospital?
Absolutely, and we have looked at that very carefully. We've studied it. You can actually create an identification of patients that are likely to be at high risk. So we have developed a risk assessment tool, and that risk assessment tool allows us to categorize what is the risk of rehospitalization. And we look at this in 3 ways. We look at the person's diseases and how many they have. We look at their medications and treatments, and importantly, again, we look at what is their functional capability to take care of themselves. So we call that MC3, and there's a risk assessment tool that we make available to the public on our website, seniorbridge.com. or you can download it from iTunes, so there's an app for that. Everybody has to have an
I
app.
know. Everybody
So we
does
have an app for that that's free because we want that to be available. And we use that tool when we talk with physicians, nurses, discharge planners in hospitals, so they can assess a person and see whether they're at risk. And the greater the score of risk, the higher the risk is. And those are the people, when you identify high risk, that need help at home.
That's great. Speaking of which, geriatric care managers can be very helpful in all of this. Can you talk a little bit how they help families and help people manage all the needs of caring for an aging loved one?
Well, the first thing that a care manager does is to assess the overall situation. So the first thing we want to do is understand what is the circumstance the person is living in, what's their home like, what's their environment, what's their support. It's not just medical, it's how do you see the person in the environment in which they live. And then it's what kind of medical conditions they have and what do they need in terms of medications. And then it's how do they have access to health care and who are their doctors and are they available. So a professional care manager understands all those issues. So a geriatric care manager can provide the kind of advice that's needed to coordinate the kinds of things an older person needs. Now, we use nurses and social workers because it's not just medical and it's not just organizing the person's environment, it's understanding the psychosocial needs and condition of the person. So behavioral problems, for example, depression or anxiety disorder, affects how somebody takes care of themselves. So social workers engage a person, counsel people, try to get the parent and the family to understand what the issues are. So it's important to use a team approach. So the first and most important thing is assess the patient, then make a plan, a holistic plan, and then over time guide the person to a healthier and more functional capability. Now, we offer that assessment for free, by the way. So if somebody would like our help, you can go to seniorbridge.com or you can call us at 866-506-1212, 866-506-1212, and we'd be more than happy to give you a complimentary, a free consultation about what your problems and what your solutions might be, so that you have an initial way to understand, what kinds of things you might need in the future.
Yeah, no, that's great, and I don't want to sound like a commercial, but we went through all of that, and it was really great for us. We have about 2 minutes left, so we have one more question, and I'm going to ask about healthcare reform, because that is a discussion that is in the news a lot. And how do you see healthcare reform impacting elder care and families who are caring for their aging loved ones?
Well, that's definitely more than a 2-minute conversation, but I'll do it in 2 minutes. So I think you have to look at it for the long run. We have a healthcare reform legislation. It has a lot to do with insurance regulation initially, but in that healthcare reform legislation is funding to begin to look at how care coordination can change the well-being of Medicare beneficiaries. And that is a key for the future, that we're going to see movement from taking care of people in an acute care way, fee-for-service, intermittent, episodic, especially in hospitals, to taking care of people continuously over the long term at home. And that healthcare reform creates incentives to develop methods like the methodology that SeniorBridge uses to take care of people at home over the long run. And so I think in the final analysis, healthcare reform will essentially change the way we look at people and care for them, and change that from acute care to chronic care, and change that from at hospital to at home.
It's great, and I couldn't agree with you more. And I think there's I know a lot very controversial, but there are definitely some interesting and good things happening in the healthcare reform bill. So just wanted to close and say thank you so much for joining us today. It was a terrific discussion, and also thank you to the audience for joining us today. And to learn more about future shows, sign up for our newsletter at www.ecarediary.com. Thank you very much, Dr.
Thank you. Nice to be here.